Hello folks, and welcome back to my channel. Today I'd like to talk a little bit more about irritation bumps and issues that we have when healing piercings. We've talked about this topic a number of times before on my channel, and without fail, whenever I discuss this, people always are in my comments saying, well, what if I have an infection? I think my piercing is infected. What do I do about this? Is it irritated? I just can't tell. So today I wanted to sit down and discuss the difference between infection and irritation, how they can present in body piercings, and how we can handle it. To begin this video, a small disclaimer. I am not a medical professional, and this video is not intended to replace medical advice. Infections can only be diagnosed by licensed medical professionals, doctors, nurses, things of that sort. Piercers are not qualified to diagnose infection. If you ever suspect genuine infection in your piercing, please seek out medical attention and medical care. This video is from the perspective of a professional body piercer with almost 12 years of experience in the industry, discussing my personal experience with irritation on piercings and some of the things I have seen regarding infection. Once again, this video does not replace medical advice. Let's start by defining things. What is an infection? Well, an infection occurs when a microorganism such as bacteria, fungi, or virus enter a person's body and cause harm. Infections are specifically caused by these microorganisms, and depending on the type of microorganism causing your infection can present differently. Now, what about irritation? Irritation occurs when something disrupts the healing process of a body piercing, causing the piercing to have issues with healing. Now, irritation can be caused by microorganisms like bacteria, but irritation is much more commonly caused by things like catching and snagging your piercing, wearing improper jewelry, changing it too soon, sleeping on your piercing, getting makeup or soap in it, a number of different factors, most of them environmental factors or aftercare factors. Now, irritation and infection are very different. If someone has an irritated piercing, inherently, it's not infected, it's just irritated. Once it crosses that line into infection, that is no longer an irritated piercing. That is an infected piercing that typically needs medical assistance. But I've noticed there's a lot of confusion between the two and a lot of misinformation. A lot of clients don't really understand what the difference is between infection and irritation. Let's start by looking at infection. Infections in piercings tend to be very severe. Some of the most common infections we see in piercings are cellulitis and staph infections. Infections come with a large amount of swelling. Take a peek at this picture here. Notice how the entire area of the ear is very swollen. We can no longer see any of the defined ridges or cartilage structures of the ear. This is the type of swelling that we're talking about. It can also be very red and hot to the touch. There can be a large amount of foul-smelling secretion, and you may be experiencing fever and flu-like symptoms. Because infections are caused by harmful microorganisms, they require medical attention to improve. You're going to need to see a medical professional, figure out what type of infection you have, and get proper medication in order to help your immune system clear this infection. If it's severe enough, the area may need to be cut open and drained in order to allow the infection to clear fully. Notice how severe things are looking in all of these photos. That's what I really want you to focus on, because infections are pretty distinct when it comes to body piercings. Now, what about irritations then, if that's what infection look like? So irritations can present in a wide variety of ranges. The most common thing that we think of when we think about an irritated piercing is the bump. That's right, piercing's getting this bump on it. And the bump can vary in size, shape, color, texture. Here are just a couple different examples of piercing irritation bumps and how differently they can look. But one thing that I want us to note in all of these images is that it still remains localized to the area around the piercing. Now, irritation bumps can range. Sometimes they're very small, like this one, and just a simple little irritation bump, but sometimes they can be really big and severe, like this one. They can be more moisture-based irritation bumps, like this one, or they can be very dry with a lot of exfoliation, like this one. The cause of the irritation is kind of what determines how we see the bump end up looking. Irritation that's from wearing jewelry that's the wrong style, like this hoop that was too small and put in too soon, we can see this bump is kind of following the curvature of the hoop and is clearly from the jewelry. But sometimes we have irritation like this one, which is a moisture irritation. This can happen sometimes when piercings are allowed to get too wet, or we have issues with secretions and cleaning in our aftercare process. Now, these bumps look very different, but they're both forms of irritation on piercings. Now, are we noticing some of the differences? Take a peek here at this picture of irritation, and then take a peek here at this picture of infection. Notice how different these two things are presenting on the body. When we look at the image of infection, we see a lot of very widespread swelling, a lot of very widespread redness. We can see that this is affecting a much larger area and is much more severe. Whereas even though this irritation bump doesn't look very good and is not very enjoyable to be dealing with, it is still very localized to the area around the piercing, and we don't have nearly the same amount of redness, secretion, swelling, any of these other factors that tend to be present when there is an infection present. Now, if you're dealing with issues with your piercing healing and you're unsure if what you have is a genuine infection or irritation, you should always seek out professional help rather than just letting it go on your own and kind of hoping it gets better or hoping you figure it out. That's literally what professionals are here for. It's our job. If you suspect genuine infection, you should always seek out medical attention. Or head to your GP or head to urgent care and get your ear looked at, get your body looked at, and make sure that what you have is not a genuine infection. Now, if you're unsure and you're unable to make it into your doctor, or they don't have any appointments available and you want to be 100% sure before you go to urgent care, you can also contact a piercer to just have them take a quick peek and say, hey, does this look like something I can come in and see you for help with, or does this look like something that I should go see a doctor about? And your piercer will be able to tell you that. Now, a big part of why I wanted to make this video is I have had a lot of clients have some not so great experiences going to see doctors when they're unsure of what's going on with their piercing. I am not a medical professional. This video does not replace medical advice, and in no way by saying this am I trying to invalidate the knowledge and experience of medical professionals. But my personal experience in occasionally going to the doctor while having issues with some of my piercings, and the experience of many of my clients has been kind of as follows. I vividly remember going into the doctor for an entirely unrelated issue. I was dealing with an allergic reaction to mangoes, of all things, and the doctor saw that I had an irritation bump on one of my nostril piercings. There were nothing really else wrong with it. It just had a little bump on it. I had cotton snagged it on my glasses a couple of weeks ago, and it was just still kind of recovering from that because it was a really good snag. But the irritation bump was healing up. It was pretty small. There was no redness, no tenderness, no swelling, no excess secretion, just a tiny little ridge of irritated tissue on the front side of that piercing. And it was healing up really well. I mean, this was very small. And the doctor saw that while examining me for my allergic reaction and simply said to me, oh, your nose piercing is infected. Let me write you a script for antibiotics. And I said, oh, what makes you feel that it is infected? And he said, well, it has that bump on it. And I said, okay, well, I'm not experiencing any other signs or symptoms of infection. Would you mind swabbing and testing it for me before you prescribe me antibiotics? Because generally, if they are diagnosing infection, they can swab and test some of the fluid or secretion coming out from the area to determine what type of infection it is, what type of microorganism is causing it, so that they can prescribe you the proper antibiotic that will work the best for that type of infection. And the doctor was kind of resistant to test me. He said, well, I see these bumps on piercings all the time. They're just always infections. We'll just give you antibiotics. But be warned, sometimes even antibiotics don't make this go away. To which I responded, well, irritation bumps can happen on piercings, and they're not typically an infection. They're not typically caused by bacteria or viruses or fungi. They are just a result of sleeping on your piercing weird or having bad jewelry or catching or snagging it. I would really prefer it if you tested me before you prescribed me anything. He agreed to test me, took the swab, did everything, came back, no infection present, no bacteria, no viruses, no fungi, no prions, nothing, no infection present. And I did get treated for my mango allergy reaction though, but I went back to the doctor a few weeks later and the irritation bump was totally gone. It had just healed up over time once I was no longer, snagging it on my glasses. And I pointed this out to him and mentioned, I work as a professional piercer. Irritation bumps can happen sometimes. Have you thought about swabbing and testing people for these things and making sure that it's infection? And the doctor told me, well, no, I just always assumed it was infection. It would make a lot of sense that it's not. I have one client who I've prescribed antibiotics to over a dozen times, and it's never gotten the bumps on her piercings to go away. And that's kind of been a lot of my clients' experiences, is that doctors will just kind of take a look at a piercing sometimes and not really take a thorough look, not swab or test it, not really check it out deeply in general, just say, oh, there's something wrong with your piercing, it's infected, let's give you antibiotics. And again, there is a very large difference between infection and irritation. And when you have an infection, you absolutely should go see a medical professional, see a doctor, get on proper antibiotics, get treatment to help this go away. But if what you have is just a small irritation bump, antibiotics probably aren't going to make a very big difference, especially not if it's irritated because you're wearing low quality jewelry or you sleep on it every night. The antibiotics aren't going to fix those things and your bump is probably going to persist. So my hope is that this video will help you better identify what is going on with your piercings, but also feel better prepared to advocate for yourself, both with a piercer and with a doctor. If you are seeing or feeling something out of the normal and you truly suspect that it might be infected, please go see a medical professional. Trust your gut when you have those feelings. But when you see medical professionals, if you feel like your piercing is just irritated and you're not showing any other signs and symptoms and you're skeptical of being put on more antibiotics, don't hesitate to advocate for yourself and ask for them to thoroughly test the area and make sure that what they're prescribing you is correct and effective and what you need in this situation. It's also worth mentioning for clients out there that laws surrounding infection in some states are very, very strict. There are some states in the country where if you even come into a studio and say, I think my piercing might be infected, legally we can no longer touch it or help you or offer you any advice. We can only tell you, okay, then go see a doctor. And I understand why these laws exist, and I understand why certain health departments enforce them this way, and we don't want piercers crossing the line into practicing medicine or diagnosing, and that's very important. Like I've said multiple times throughout this video, piercers cannot diagnose infection. It is not our place to, it is not our job. But it does sometimes leave us in a bind where we see clients come in with what is very clearly irritation, but because they've said, I think it's infected, the only thing we can do now is send you to the doctor. So I'm hoping that sharing some more education about the difference between irritation and infection and helping clients be better equipped with an understanding of what to look for and also what vocabulary to use will hopefully help folks communicate more accurately with piercers and be able to get better help for what they need in these situations. Irritation and infection are both two things that can go wrong when we're healing a piercing, but they're also two things that present very, very differently and have two very different fixes and corrections in order to get them to clear up. So it's really important that we correctly identify if we're dealing with irritation or infection, and we treat the piercing accordingly. If you've found this helpful, I would love to hear down in the comments if this helped make things clear, the difference between you. And if there's anything else about like irritation bumps and healing issues y'all want to see me cover, let me know as well, because I've been getting a lot of really good questions about this stuff lately, and I'm super excited to dive more into some healing and troubleshooting content with y'all. As per usual, have a wonderful rest of your day, and I'm sure we'll chat again soon. Bye.